Welcome to our presentation on Advanced Hospital Infection Control and Prevention, brought to you by CDG Training Private Limited. Let's explore how we can enhance safety and care in healthcare environments. Modern hospitals must protect patients, healthcare workers, and visitors from infections every day. Patient protection and clinical hygiene are foundational to safe healthcare delivery. Infection prevention is a shared responsibility across all healthcare levels. Hospitals treat patients with various illnesses and weakened immune systems. Without proper infection control, infections can spread rapidly, risking lives. Effective prevention systems save lives and strengthen healthcare safety. Healthcare-associated infections remain a significant challenge worldwide. Hospitals work tirelessly to reduce infection rates through hygiene protocols, sterilization systems, outbreak management, and safety monitoring. Healthcare safety depends on communication, coordination, and shared responsibility. Every healthcare professional, from doctors to housekeeping teams, plays a vital role in infection prevention. Simple healthcare practices significantly reduce infection risks. Consistent operational discipline improves patient safety and healthcare reliability. Small actions create major healthcare impacts. Healthcare organizations use advanced technologies for infection prevention. From sterilization tech to AI monitoring, these systems enhance safety and ensure compliance across all hospital departments. Global infectious outbreaks highlight the need for effective infection prevention systems. Prepared hospitals respond faster and manage risks more effectively during crises, ensuring rapid response and healthcare resilience. Clean healthcare environments improve patient confidence and reduce risks. Safe hospitals protect both patients and healthcare workers through sterilization, cleaning, isolation, and monitoring. Healthcare systems must adapt to emerging diseases and antimicrobial resistance. Continuous improvement and training are essential for modern infection control programs, shaping effective prevention strategies. This course covers a range of infection prevention topics, from transmission to analytics. Learners will discover how hospitals build safer and more resilient environments globally. Professionals in infection prevention help reduce risks and strengthen safety systems. Their expertise is crucial for managing healthcare safety and improving quality across healthcare settings. Infection prevention strengthens patient safety and healthcare quality. Let's begin Chapter 1 and explore the foundations of hospital infection control and prevention systems. Welcome to our comprehensive guide on hospital infection control and prevention, where we explore essential systems, clinical hygiene, and patient safety in modern healthcare environments. Infection control is vital for maintaining safe healthcare environments, protecting patients, staff, and visitors from infectious risks every day. Healthcare environments inherently carry increased infection risks due to various high-risk activities, making infection control crucial across all departments. Infection prevention protects both patients and healthcare workers by reducing exposure to harmful microorganisms and ensuring shared protection. Infection control is a major healthcare quality priority, involving hygiene systems, sterilization procedures, outbreak management, and infection monitoring. Microorganisms can spread through multiple pathways, including direct contact, airborne transmission, medical equipment, and bodily fluids. Hand hygiene is one of the most important safety measures, significantly reducing infection spread within healthcare environments. Personal protective equipment supports infection prevention by providing barriers against infectious materials and contaminated surfaces. Clinical hygiene includes environmental safety, ensuring clean patient rooms, operating theaters, and high-contact surfaces to improve patient confidence and safety. Sterilization prevents contamination during medical procedures by ensuring medical instruments are properly cleaned and stored. Infection prevention requires teamwork across every department and professional role, ensuring coordinated and effective safety measures. Isolation procedures help prevent infection spread by using dedicated rooms, restricted access, and enhanced PPE requirements. Waste management supports clinical hygiene by ensuring proper disposal of medical waste, reducing health and environmental risks. Training helps maintain infection prevention standards by providing onboarding, refreshers, outbreak drills, and competency assessments. A real-world example shows how organized infection prevention systems improve healthcare safety and deliver measurable patient outcomes. Technology is improving infection prevention systems with AI monitoring, digital hygiene tracking, automated sterilization, and healthcare analytics. Infection prevention supports healthcare continuity by ensuring safer operations, patient confidence, reduced disruption, and healthcare resilience. Patients and visitors contribute to infection prevention through education, mask use guidance, visitor restrictions, and safety awareness. Infection prevention is continuously evolving with core hygiene practices, surveillance, antimicrobial stewardship, and healthcare innovation. Infection control is a critical healthcare profession, emphasizing the importance of skilled professionals in preventing healthcare-associated infections. Understanding microorganisms and infection transmission is crucial for preventing infections effectively, setting the stage for the next chapter. Chapter 2 provides a comprehensive guide to understanding microorganisms, how infections spread, and how healthcare systems protect patients and staff. Microorganisms are present in every corner of healthcare environments. While some are harmless, others can cause serious infections. Understanding them is crucial for effective infection prevention. Bacteria, viruses, fungi, and other agents each pose unique challenges in healthcare settings. Different prevention and control strategies are essential to manage these risks effectively. Certain bacteria can spread through contaminated surfaces and direct contact, leading to serious infections. Prevention requires constant vigilance and adherence to protocols. Viruses can spread quickly through respiratory droplets and direct contact. Hospitals implement isolation protocols to contain viral transmission effectively. Patients with weakened immune systems are at higher risk for fungal infections. Hospitals use hygiene and air quality management to protect these patients. Infections spread through a chain involving an infectious source, a transmission pathway, and a susceptible host. Breaking any part of this chain can significantly reduce infection risks. Microorganisms often spread through direct contact in healthcare settings. Consistent hygiene and protective equipment are key to reducing this risk. Airborne and droplet transmissions pose significant risks in healthcare. Hospitals use isolation protocols and ventilation systems to mitigate these threats. Surfaces in healthcare settings can become contaminated if not properly cleaned. Regular disinfection is crucial to reduce infection risks. Healthcare-associated infections are a significant concern, affecting 1 in 31 patients and costing billions annually. Effective prevention can reduce these numbers substantially. Patients with weakened immune systems are more vulnerable to infections. Hospitals implement targeted prevention strategies for these high-risk groups. Medical devices, if not managed properly, can increase infection risks. Strict sterilization and monitoring procedures are essential to prevent infections. Antimicrobial resistance is becoming a global issue due to misuse of antibiotics. Responsible practices are crucial to slow down resistance development. A hospital effectively reduced infection rates by improving equipment cleaning and monitoring. This case shows the impact of targeted interventions. Infection risks are present in non-clinical areas like waiting rooms and cafeterias. Comprehensive infection prevention measures are essential throughout healthcare facilities. Infection surveillance systems track infection rates and patterns, helping hospitals respond quickly to emerging threats and improve prevention strategies. AI and digital tracking technologies enhance infection risk detection and prevention in healthcare settings, improving overall safety and efficiency. Continuous awareness of hygiene practices and environmental cleanliness is crucial for effective infection prevention in healthcare settings. Understanding how infections spread helps hospitals implement stronger prevention systems, enhancing patient safety and reducing infection risks. Hand hygiene, personal protective equipment, and standard precautions are vital for preventing infection spread in healthcare settings. Explore essential infection prevention techniques in healthcare, focusing on hand hygiene, PPE, and standard precautions. Hand hygiene is crucial in preventing infections, reducing risks, and ensuring patient safety. Microorganisms spread through contact with surfaces, fluids, and cross-contamination, emphasizing safe practices. Proper hand hygiene protects both patients and healthcare workers from infections. Hospitals follow structured hand hygiene protocols to prevent infection spread. Using soap and water effectively removes contaminants, ensuring safety. Alcohol-based sanitizers offer convenience and efficiency in infection prevention. PPE reduces exposure risks, protecting healthcare workers and patients. Different healthcare situations require specific PPE to ensure safety. Gloves are essential in reducing direct contact risks during procedures. Masks and respiratory protection are vital for airborne safety in healthcare settings. Proper PPE removal is crucial to prevent contamination and ensure safety. Standard precautions, including hand hygiene and PPE, apply to all patients to prevent infections. Sharps safety is essential to prevent occupational exposure and ensure healthcare safety. Improving hand hygiene compliance enhances patient safety and infection prevention. Environmental hygiene supports standard precautions, enhancing infection prevention. Managing PPE supplies is crucial for maintaining healthcare readiness and safety. Continuous training improves infection prevention compliance and safety culture. Technology supports infection prevention through monitoring and compliance tools. Hand hygiene and PPE are foundational to healthcare safety, reducing infection risks. Clinical cleaning, disinfection, and sterilization are essential for infection control in healthcare. Chapter 4 delves into the essential systems for clinical cleaning, disinfection, and sterilization. This comprehensive guide focuses on environmental hygiene, infection prevention, and maintaining high standards in healthcare settings. Maintaining clean healthcare environments is crucial for patient safety. Hospitals must manage microorganisms, contaminated surfaces, and medical waste effectively to prevent infection risks. Routine clinical cleaning is vital for reducing environmental contamination. It helps remove dirt, microorganisms, and infectious materials, enhancing patient safety and confidence. Disinfection is key to eliminating harmful microorganisms using chemical or physical methods. It strengthens infection prevention across healthcare environments. Sterilization is a controlled process that destroys all forms of microbial life on surgical instruments, reducing infection risks during procedures. Healthcare areas require varying cleaning protocols based on contamination risk. Critical areas like operating theaters need the most rigorous cleaning procedures. High-touch surfaces in healthcare settings require frequent cleaning to prevent infection. Regular disinfection of these areas is crucial for maintaining safety. Proper processing of medical equipment is essential to reduce infection risks. This includes cleaning, disinfection, inspection, packaging, and sterilization. Cleaning staff are crucial in maintaining hygiene and patient safety in healthcare settings. They follow strict protocols to ensure effective cleaning and disinfection. Correct use of cleaning chemicals is vital for safety and effectiveness. Hospitals must ensure proper selection, dilution, and application to prevent hazards. Sterilization departments must maintain strict operational control to ensure the safety and effectiveness of sterilization processes in healthcare settings. Continuous monitoring of sterilization processes is essential to maintain effectiveness and safety in healthcare environments. Isolation areas require enhanced cleaning procedures to reduce transmission risks. These measures are crucial for infection control in healthcare settings. Proper waste management is vital for maintaining environmental hygiene in healthcare facilities. It reduces contamination and infection risks. Effective sterilization systems are crucial in preventing equipment-related infections. Continuous monitoring and corrective actions ensure patient safety. Proper ventilation and air quality control are essential for infection prevention in healthcare settings. These systems help manage contamination risks effectively. Advanced technology is transforming healthcare hygiene systems, enhancing infection prevention and operational efficiency. Continuous training is essential for maintaining high standards in cleaning and sterilization. It ensures consistency and effectiveness in infection prevention. Continuous improvement in environmental hygiene is crucial for enhancing healthcare safety and reliability. Regular evaluation and monitoring are key. Cleaning and sterilization are foundational to healthcare safety. They reduce infection risks, protect patients, and ensure operational reliability. The next chapter will explore healthcare-associated infections and patient safety in detail, focusing on strategies to reduce infection risks. Explore the critical role of healthcare-associated infections and patient safety in clinical environments. Healthcare-associated infections, or HAIs, remain a significant global challenge, impacting patient safety and healthcare outcomes. Preventing these infections is a top priority for healthcare systems worldwide. HAIs can affect various healthcare areas, from operating theaters to outpatient settings, each with unique infection risks and prevention needs. HAIs may lead to severe patient complications, making prevention crucial for safer healthcare delivery. Patient safety and infection prevention are interconnected through hygiene systems, sterilization procedures, communication systems, and operational safety. Surgical procedures can increase infection risks if proper sterilization, hygiene, and protocols are not followed. Catheters and medical devices require careful monitoring to prevent device-related infections. ICUs need advanced infection control measures to protect vulnerable patients with weakened immune systems. Hand hygiene is a powerful tool in preventing HAIs, with specific moments and durations recommended for effective practice. Environmental hygiene plays a crucial role in reducing HAIs by ensuring clean healthcare environments. Isolation precautions are essential in preventing infection spread within healthcare facilities. Surveillance systems help detect infection trends, enabling faster responses and improved prevention strategies. Antimicrobial resistance poses significant healthcare risks, making infection prevention and surveillance crucial. Effective HAI prevention requires teamwork and communication across all healthcare departments. A real-world example shows how coordinated infection prevention strategies can significantly reduce ICU infections. Patient education is vital in supporting infection prevention by teaching hygiene practices and visitor policies. Technology enhances HAI prevention systems, enabling faster and more informed decision-making. Continuous improvement in infection prevention systems strengthens patient safety and healthcare quality. Strong infection prevention systems build public trust by ensuring clean environments and effective safety measures. HAI prevention is a critical healthcare responsibility, requiring teamwork, hygiene compliance, and operational discipline. Isolation procedures, transmission-based precautions, and outbreak control are essential for managing infectious threats. Explore essential procedures for controlling infections, protecting patients, and managing outbreaks in healthcare settings. Hospitals must act swiftly to prevent infections by using isolation systems that protect patients, workers, and visitors. Healthcare organizations implement transmission-based precautions to enhance infection prevention beyond standard measures. Isolation is crucial for protecting vulnerable patients, including those with weakened immunity or in high-risk groups. Contact precautions, including gloves and gowns, reduce transmission risks through direct contact in healthcare settings. Droplet precautions, such as masks and distancing, help prevent respiratory transmission in healthcare environments. Airborne precautions require advanced systems like negative pressure rooms and specialized ventilation to manage infectious diseases. Isolation rooms need controlled environments with restricted access, dedicated ventilation, and enhanced cleaning protocols. PPE is vital during isolation care, providing essential protection for healthcare workers and patients. Environmental cleaning is essential for outbreak control, focusing on high-contact surfaces and patient equipment. Visitor management systems help reduce infection risks by controlling access and ensuring compliance with safety protocols. Early detection through symptom monitoring and laboratory reporting improves outbreak response and containment. Effective communication is crucial during outbreak management, involving all healthcare teams and agencies. Continuous staff training strengthens isolation compliance and enhances outbreak preparedness in healthcare settings. A real-world example shows how managing a respiratory outbreak involves rapid response and coordinated efforts. Healthcare workers need emotional and operational support to maintain high standards of care during outbreaks. Technology enhances outbreak monitoring and response, improving speed and operational visibility in healthcare settings. Public health coordination with various agencies supports healthcare safety and outbreak preparedness. Continuous improvement in outbreak preparedness involves evaluating systems and updating protocols based on past events. Isolation and outbreak control are essential for healthcare safety, involving multiple precaution types and continuous monitoring. Biomedical waste management and environmental infection prevention play crucial roles in the next steps of infection control. Explore the essentials of biomedical waste management and environmental infection prevention in healthcare settings. Effective biomedical waste management is crucial for maintaining healthcare safety, reducing infection risks, and ensuring quality care. Healthcare facilities manage various waste types, each requiring specific handling and disposal procedures to ensure safety and compliance. Infectious waste can spread harmful microorganisms if not properly managed. Effective response strategies are essential for infection prevention. Proper waste segregation is a vital step in infection prevention, using color-coded containers and designated procedures to minimize risks. Sharps waste poses significant risks and requires careful handling and disposal to prevent injuries and infections. Maintaining environmental hygiene in healthcare settings is key to reducing contamination risks and ensuring patient safety. Controlled procedures for waste transportation are essential to minimize exposure and ensure safe handling within healthcare facilities. Safe and organized storage areas are crucial for effective biomedical waste management, ensuring safety and compliance. Proper disposal methods for biomedical waste are essential to protect public health and reduce environmental impact. Housekeeping teams are essential in maintaining healthcare safety through effective cleaning and waste management practices. Personal protective equipment is crucial for protecting healthcare workers from exposure risks during waste management activities. Immediate response to spills is critical in preventing contamination and ensuring safety in healthcare environments. Continuous staff training is vital for maintaining compliance and ensuring effective waste management in healthcare settings. A real-world example shows how improving waste segregation compliance can significantly reduce contamination risks. Regular environmental monitoring helps identify improvement opportunities and supports healthcare safety and quality. Sustainable practices in healthcare waste management are becoming increasingly important for environmental and public health. Emerging technologies enhance waste management systems, improving visibility, compliance, and infection prevention. Continuous improvement in infection prevention practices is essential for maintaining safe healthcare environments. Effective biomedical waste management is crucial for protecting patients, healthcare workers, and communities from infection risks. The next chapter will focus on infection prevention in critical care areas, highlighting unique challenges and solutions. Infection prevention in high-risk clinical settings is crucial for patient safety and effective healthcare delivery. Critical care areas demand advanced infection prevention to protect vulnerable patients and manage complex procedures. ICU patients are at increased risk of infection due to weakened immunity and invasive procedures, necessitating enhanced prevention systems. Operating theaters require controlled environments to minimize contamination and ensure patient safety during surgical procedures. Surgical site infections are a major concern, requiring strict protocols in sterilization, PPE use, and hygiene to protect patients. Air quality management is vital in critical care areas to reduce airborne contamination and ensure patient safety. Sterilization is essential in surgical procedures to prevent infections, involving thorough cleaning and monitoring of instruments. PPE is vital for protecting both patients and surgical teams from infection risks during procedures. Hand hygiene is critical in critical care areas to prevent infection transmission and ensure patient safety. Medical devices can increase infection risks, requiring regular inspection and timely removal to ensure patient safety. Environmental cleaning in critical care areas is essential for maintaining hygiene and preventing healthcare-associated infections. Isolation precautions are common in critical care areas to prevent infection spread and protect patient health. Surveillance helps detect infections early, enabling prompt intervention and improved patient outcomes. Communication and teamwork are essential for improving safety in critical care settings, ensuring coordinated patient care. A real-world example shows how reducing ventilator-associated infections improves patient outcomes through coordinated prevention efforts. Emergency departments require rapid infection control decisions to manage multiple patients and ensure safety. Technology is enhancing infection prevention in critical care, providing faster and more accurate responses to emerging threats. Staff training is crucial for safe critical care operations, ensuring healthcare professionals are prepared for infection prevention and emergency response. Continuous improvement strengthens critical care safety by evaluating and enhancing infection prevention systems. Infection prevention in critical care areas saves lives by reducing complications and improving patient safety. Next, we will explore occupational safety, healthcare worker protection, and exposure management to ensure continuity and patient safety. Explore the essentials of occupational safety, healthcare worker protection, and exposure management in modern healthcare environments. Healthcare worker safety is crucial for maintaining healthcare continuity. Protecting workers ensures reliable operations and patient safety, while system resilience strengthens overall healthcare resilience. Hospitals face multiple occupational hazards, including biological, chemical, physical, psychological, and environmental risks. Implementing safety systems is essential to mitigate these hazards. Infection exposure is a major healthcare risk. Prevention systems, including structured protocols and monitoring, are vital for reducing exposure risk significantly. Personal protective equipment, PPE, is critical in protecting healthcare workers from contamination and transmission risks. Proper use of PPE strengthens occupational safety. Sharps injuries require immediate attention due to the risk of infection. Implementing proper disposal systems and procedures is essential for healthcare safety. Hand hygiene is a fundamental practice that protects healthcare workers by reducing contamination risks. Consistent hygiene practices support safer healthcare operations. Vaccination programs are essential for protecting healthcare workers from infections and maintaining workforce resilience. They are a cornerstone of occupational infection prevention. Exposure management requires rapid response systems to handle incidents effectively. Structured procedures improve safety outcomes for healthcare workers. Safe waste handling is crucial for occupational protection. Proper disposal of biomedical, chemical, and sharps waste, along with environmental cleaning, supports safety. Ergonomic safety helps prevent physical injuries in healthcare settings. Implementing ergonomic solutions reduces strain risks for healthcare professionals. Mental health and emotional well-being are vital for healthcare workers. Support programs and workload management improve overall safety and quality of care. Emergency preparedness is essential for protecting healthcare workers. Training and protocols ensure readiness for various emergencies, enhancing safety. Open communication improves workplace safety by encouraging reporting and feedback. A blame-free environment supports occupational protection. A case study on reducing needlestick injuries shows how structured safety systems improve healthcare worker protection outcomes. Environmental safety measures support workforce protection by reducing occupational risks in healthcare facilities. Safe environments improve operations and worker safety. Technology is enhancing occupational safety systems through AI monitoring, safety alerts, and analytics. These innovations strengthen safety and compliance. Leadership plays a crucial role in fostering a safety culture. Establishing policies and accountability strengthens healthcare safety significantly. Continuous improvement strengthens occupational safety by evaluating and enhancing safety systems. Ongoing assessment ensures better protection over time. Healthcare worker protection is essential for healthcare excellence. Strong safety systems reduce risks and improve patient care quality. Infection surveillance, audits, and compliance monitoring are crucial for strengthening infection prevention and healthcare quality. Chapter 10 delves into how healthcare organizations detect risks early, evaluate performance, and continuously improve infection prevention through data-driven monitoring and accountability systems. Hospitals continuously evaluate infection trends, hygiene practices, operational risks, and patient safety indicators to maintain safe healthcare environments. Infection surveillance identifies problems early, compliance monitoring ensures adherence to protocols, and healthcare quality supports overall reliability. Healthcare organizations collect and analyze data related to healthcare-associated infections, outbreak trends, and hygiene compliance. Early detection helps hospitals respond quickly before problems escalate, improving preparedness and patient protection. Hospitals monitor infection rates to identify high-risk departments, operational weaknesses, and contamination patterns. Continuous evaluation strengthens patient safety systems and enhances decision-making. Healthcare audits help organizations evaluate hygiene compliance, sterilization systems, PPE use, waste management, and operational consistency. Audits identify strengths, weaknesses, and opportunities for improvement, enhancing healthcare accountability. Hospitals must ensure that healthcare professionals follow infection prevention protocols consistently. Compliance monitoring improves operational discipline and strengthens patient protection. Hospitals collect operational data related to infection trends, hand hygiene performance, and environmental cleaning. This data supports smarter healthcare management and improves infection control strategies. Healthcare organizations regularly evaluate hand hygiene compliance through observation systems, digital tracking tools, and audit programs. Improving compliance helps reduce healthcare-associated infection risks significantly. Hospitals inspect cleaning procedures, sterilization systems, waste management practices, and air monitoring to reduce contamination risks. Environmental monitoring enhances infection prevention. Continuous monitoring allows hospitals to identify unusual infection patterns, emerging outbreaks, and transmission risks early. Prepared systems strengthen response and protect patients. Hospitals encourage staff to report infection risks and operational concerns to strengthen safety systems. Open reporting supports continuous improvement and patient protection. When audits identify weaknesses, hospitals implement corrective actions such as retraining, workflow improvements, and policy updates. These actions strengthen healthcare quality. Hospitals increasingly use AI monitoring platforms, digital dashboards, and predictive analytics to strengthen infection surveillance and compliance monitoring. Technology improves visibility and response speed. Healthcare organizations regularly train staff on hygiene standards, surveillance systems, and reporting procedures. Education improves consistency and patient safety. This case study demonstrates how surveillance and audits translate into measurable improvements in infection prevention performance. Steps include audit identification, intervention design, awareness campaigns, and outcomes improvement. Healthcare leaders help establish infection prevention policies and allocate resources effectively. Strong leadership influences system performance and strengthens healthcare reliability. Hospitals often compare infection prevention performance against standards and targets. Benchmarking helps identify improvement opportunities and strengthen strategies. Healthcare risks continue evolving due to emerging diseases and operational complexity. Continuous monitoring helps organizations remain prepared and adaptable, improving resilience. Organizations with strong communication, teamwork, and accountability often achieve stronger hygiene compliance. A positive culture strengthens healthcare quality systems. Modern surveillance systems provide around-the-clock visibility into infection risks and compliance performance. They form the foundation of modern infection prevention efforts. Technology continues transforming infection prevention through AI monitoring, healthcare analytics, and smart hospital infrastructure. These advancements support more effective infection control management. Explore how digital innovation, artificial intelligence, and smart infrastructure are transforming infection prevention and patient safety in modern healthcare. Modern healthcare organizations are leveraging digital systems, healthcare analytics, and smart infrastructure to enhance infection prevention and patient safety globally. Hospitals use digital platforms to monitor a wide range of infection prevention metrics, improving efficiency across all departments. Healthcare organizations collect and analyze infection data to identify risks and improvement opportunities across operational areas. AI systems detect infection patterns, predict outbreaks, and improve compliance monitoring, enhancing infection surveillance. Hospitals use digital hand hygiene systems to improve compliance and reduce infection risks. Healthcare dashboards provide real-time data to monitor infection rates, PPE inventory, and environmental hygiene performance. Air quality systems strengthen infection prevention by controlling airborne pathogens in clinical areas. Digital sterilization systems improve equipment processing safety and reduce operational errors. Digital platforms improve workflow efficiency and healthcare coordination by creating transparent, accessible records for infection prevention activities. Predictive analytics help hospitals implement preventive measures proactively, improving patient outcomes and reducing infection risks. Hospitals use automation to reduce delays and improve infection prevention workflows. Telemedicine supports infection prevention by enabling remote consultations and reducing hospital visits. Healthcare organizations must protect systems against cyberattacks to maintain patient safety and trust. AI-powered infection surveillance systems significantly improve infection response speed and reduce healthcare-associated infections. Integrated hospital platforms enhance communication and operational efficiency, improving infection prevention efforts. Wearable monitoring devices enhance healthcare by providing continuous data streams for infection prevention. Modern infection prevention systems require professionals skilled in digital healthcare technologies and analytics. Continuous innovation helps healthcare systems adapt to changing healthcare risks and emerging infectious threats. Digital healthcare systems are essential for modern infection prevention, combining technology with strong operational systems. Preparedness systems help hospitals respond more effectively during crisis situations, ensuring patient care continuity. Explore how to build resilient healthcare systems that protect patients, staff, and operations during crises. Hospitals must be ready for emergencies to protect patients and staff. Preparedness ensures resilience and effective response during crises. Pandemics can quickly overwhelm healthcare systems, causing surges in patient volume and resource shortages. Preparedness is key to stability. Emergency preparedness is crucial for patient safety, ensuring that healthcare systems can respond effectively under pressure. Effective pandemic response requires organized coordination among various healthcare teams and services. Infection prevention systems are vital during pandemics to reduce transmission risks and improve containment. Isolation and triage systems help control infection spread by separating high-risk patients and managing movement within facilities. Managing PPE supplies and resources is critical during pandemics to ensure healthcare continuity and safety. Clear communication is essential during emergencies to ensure effective coordination and response. Healthcare workers need protection and support during pandemics to manage stress and maintain effective care. Emergency preparedness includes disaster recovery planning to restore healthcare services effectively after crises. Public health coordination strengthens pandemic response by integrating efforts across various healthcare sectors. Technology enhances emergency response systems by enabling faster, more informed decision-making during crises. Telemedicine supports healthcare continuity during outbreaks by reducing patient load and improving access to care. A real-world example demonstrates the importance of emergency preparedness systems in managing a pandemic surge effectively. Business continuity planning supports healthcare operations by ensuring essential services are maintained during emergencies. Emergency drills improve organizational readiness by evaluating and enhancing response procedures and coordination. Continuous learning strengthens future preparedness by evaluating performance and identifying areas for improvement. Global healthcare risks continue to evolve, requiring adaptable and resilient systems to ensure long-term stability. Emergency preparedness is essential for modern healthcare, ensuring patient protection and operational excellence during crises. International infection control standards and compliance are crucial for maintaining patient safety and healthcare quality. Explore the global frameworks and regulatory requirements that ensure patient safety and healthcare quality worldwide. Modern healthcare organizations rely on international standards to maintain patient safety and healthcare excellence. Structured guidance across hospital operations ensures safer healthcare environments. Accreditation strengthens public trust and demonstrates a commitment to quality improvement. Compliance with regulations ensures safer and more organized healthcare environments. International guidelines and compliance monitoring significantly reduce healthcare-associated infections. Sterilization standards are crucial for protecting surgical safety and ensuring consistent healthcare quality. Structured protocols are essential for effective isolation and outbreak management in healthcare settings. Proper waste management is vital for protecting public health and maintaining a safe healthcare environment. Safety standards protect healthcare workers by ensuring proper equipment use and emergency preparedness. Accurate documentation is key to operational transparency and accountability in healthcare. Audits identify weaknesses and drive measurable quality gains in healthcare operations. Regular training strengthens healthcare culture and supports compliance with regulations. Digital systems enhance compliance monitoring and improve healthcare management. A hospital prepares for an accreditation inspection, showcasing the importance of compliance systems. Leadership plays a crucial role in fostering a culture of compliance and safety in healthcare. Benchmarking helps hospitals improve performance by comparing standards and identifying opportunities. Standardized safety systems are essential for global healthcare coordination and patient safety. Continuous improvement ensures healthcare organizations remain prepared for future challenges. Accreditation and compliance are vital for modern healthcare, ensuring safety and reliability. Strong leadership and a culture of continuous improvement are key to infection prevention. Explore how leadership, culture, and continuous improvement systems drive safer healthcare environments and stronger patient outcomes. Healthcare environments constantly face evolving infection risks, necessitating continuous improvement in prevention systems and safety strategies. Leadership plays a crucial role in establishing infection prevention policies and enhancing healthcare safety culture. A strong infection prevention culture influences daily healthcare behavior, promoting hygiene compliance and open communication. Continuous improvement cycles help reduce infection risks by evaluating trends and enhancing hygiene and cleaning practices. Engaged healthcare teams contribute to infection prevention through teamwork, accountability, and active participation. Training and education in hygiene practices and outbreak management support long-term healthcare improvement. Open communication is vital for improving healthcare safety culture, allowing for early risk reporting and continuous feedback. Audits and monitoring are essential for continuous improvement, supporting healthcare accountability and performance evaluation. Leadership encourages accountability and responsibility, creating environments where infection prevention is prioritized. Learning from incidents helps improve future performance by identifying lessons and strengthening systems. Innovation in digital systems and analytics supports infection prevention improvement through real-time monitoring and decision-making. Teamwork in infection prevention involves collaboration across various roles, all contributing to a shared goal of healthcare excellence. Recognition and positive reinforcement encourage compliance, motivating staff and strengthening healthcare culture. A real-world example shows how leadership and culture improve healthcare quality and patient safety outcomes. Emotional intelligence supports healthcare leadership by enhancing communication, empathy, and resilience. Sustainability and long-term planning improve healthcare stability by supporting operational consistency and adaptability. Benchmarking helps organizations improve by aligning with standards and evaluating performance for continuous enhancement. Continuous improvement is a long-term commitment involving evaluation, innovation, and education to enhance healthcare safety. Infection prevention culture is essential for healthcare excellence, involving leadership, teamwork, and continuous improvement. Professional growth and certification offer global career opportunities in infection prevention and healthcare quality systems. Explore the pathways to professional growth and global opportunities in infection control management, a critical field in healthcare. Infection control management is a rapidly expanding global profession, essential for modern healthcare systems. Infection prevention professionals are vital in protecting healthcare systems by ensuring patient safety and reducing infections. Career opportunities in infection control span multiple healthcare sectors, from hospitals to public health and consulting. Healthcare organizations need expertise in compliance and audits to maintain safety and operational excellence. Digital healthcare skills are enhancing career opportunities in infection prevention, with a focus on analytics and smart technologies. Strong communication and leadership skills are essential for professional growth in infection prevention. Continuous learning is vital in infection prevention to keep up with emerging diseases and healthcare transformations. Professional certification enhances credibility and career prospects in infection prevention. Healthcare analytics and surveillance skills are increasingly important for operational decision-making and patient safety. Leadership opportunities in infection prevention are expanding, offering career growth at various levels. Global healthcare offers diverse career opportunities in infection prevention across various sectors. Technology is reshaping infection prevention careers, with advancements in AI, robotics, and digital platforms. Infection prevention professionals combine multiple skills, including healthcare knowledge, communication, and digital analytics. A real-world example shows how continuous learning supports long-term career growth in infection prevention. Infection prevention professionals play a crucial role in improving public health by reducing infections and enhancing safety. Emotional intelligence supports healthcare leadership by enhancing decision-making and team support. Infection prevention careers offer long-term stability and are essential for the future of global healthcare. Future healthcare will rely on prevention and innovation, integrating technology and leadership for transformation. Infection prevention is a critical healthcare discipline, essential for patient safety and quality care.